Good afternoon, good evening, good afternoon, good evening once again. This is the next episode of The Mind Game. As usual, we start things off with the Pledge of Allegiance, so let's go ahead and do it. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you guys for tuning in. Thank you. I have a very special guest today. His name is Mr. Gennaro. He's the Chief CEO up at the Veterans Hospital here in Erie, Pennsylvania. And as you all well know, we have a large veterans population here in Erie, so we're going to get right into it. Let's start off, Mr. Gennaro. Very briefly, just give me a brief synopsis of your background real quickly.
Absolutely. And first of all, thanks for having us on the show today.
Yes, sir.
It's a pleasure to serve the veterans of the Erie and surrounding counties.
Okay.
And it's an honor to be here.
Thank you.
A little bit about my background. I've been in healthcare for nearly 22 years now, and all with the Veterans Administration. I first started out my career in the Research Foundation in Cincinnati, where I went to graduate school at Erie University. And so that started nearly 22 years ago now. And I've had a number of opportunities. And that's the wonderful thing about the VA is the teaching opportunities, not only for medicine, but administrative areas and pharmacy areas and dental residencies, teaching across the board, nursing. In fact, the majority of all physicians across the nation are educated at VA hospitals.
Oh, really?
So I have had the great experience of having a lot of opportunities and training through the VA system. And so my career journey and path has taken me through Cleveland and Pittsburgh, Butler, here in Erie and Cincinnati. So it's been a wonderful experience, and it's an honor to serve our veterans.
Thank you. What you just said was I seen they did a feature on you somewhere, because everything that you just said was real fresh in my mind because I read the article. Let's get right to it. You know, over the last few years, Mr. Gennaro, I have to tell you, a light has been shown on the Veterans Administration all across the country, you know, about the services, and some places were good, some places were bad. Tell us what separates what you're doing up there in Erie at the Veterans Hospital as opposed to other hospitals as far as veterans in this country, because you're being recognized for good things that you're doing.
Absolutely.
Up there. So let's talk about that.
And to give credit to the VA overall, it's the largest healthcare enterprise in the world in terms of the operating systems of the hospitals, the outpatient clinics, and everything that the VA does for American medicines and the veterans. Here in Erie, like you said, we have a tremendous team, a committed workforce, and we're doing a fantastic job in terms of delivering outcomes and efficient, safe care to veterans. And that's not just me just saying that, but there's a whole host of benchmarks, you know, over 30 domains and metrics related to patient satisfaction, customer satisfaction, mortality rates, things like infection control rates, things like length of stay. All those type of factors are factored in terms of the quality, overall quality, safety, value of the organization. And Erie has consistently ranked in the top 10% of all hospitals across the nation. So something we're very proud of, and it's not by accident that that happens. It's having processes in place at the hospital to understand exactly where we are, to understand the patient demographics, to have high reliability organization in place where you have checks and balances, process to look at close calls, process to continually evaluate what's happening at the hospital. And we do it through our lean management system. We have what's called the Erie Management System, which is a fantastic program that we educate all of our new employees on and ongoing, where we teach employees the skills necessary to problem solve. And we encourage, from the food service worker to the physician, everybody has a part in correcting processes that they don't see are value added or may need to be tweaked. So we encourage that across the board. And I think that's one of our items that separates us, you know, from the pack.
Okay. From my experiences, I'm not a veteran, but every time that I've been up there, the thing that I've noticed about it is first impressions are tremendous. And the first thing that you notice when you go anywhere, to any facility, building, whatever, private or commercial, is the entrance. Okay, and when you go into the Veterans Hospital up there, you get a sense of cleanliness.
Absolutely.
Okay? And for the veterans to be able to have somewhere where they can go and say, well, we know it's clean, not only to recognize the benchmarks, what you're talking about as far as the quality of care and quality of service that they're getting, that means a lot. Give us an overview. There's a lot of veterans that they say are falling through the cracks and really don't know how, what, when, where to get the need and help that they need. And it's a lot of them coming from all areas of the country to these hospitals, and some of them aren't. So what would you say to the ones that aren't? How would you get them in?
Yeah, first off, to your comment about the cleanliness in the hospital, you're exactly right. We are laser focused, and VA is focused on the customer experience, the patient experience. And part of that starts right when you enter our building. You know, from how you're in parking your car.
Yeah,
you know, we have valet service for our veterans.
Okay.
That's complimentary, free of charge. We want from the moment you come to our facility to the moment you leave to be pleased with the services, and thereafter the follow-up services. So you know, our environmental management staff is highly committed, and majority, if not all of them, are veterans themselves.
Okay.
And I think that adds an extra level of detail and attention. Veterans taking care of veterans at the hospital. You know, this is not just a housekeeping job. This is everybody has their part in taking care of the veterans at our facility.
Okay.
We have tremendous outreach teams in terms of what you were talking about, in terms of how we get veterans engaged in healthcare, making sure that they know about the services.
Okay.
And one of the things we do through our public affairs department, and Sarah Gudgeon, our public affairs officer, has done a wonderful job over the past nearly decade engaging number of groups and community organizations across all of Erie and our 5 surrounding county areas, because we not only serve veterans of Erie County, but the 5 surrounding counties. So we go out to Ashtabula, out in Ohio, and we go to Meadville, Venango, Oil City, Warren, and around to Bradford near Ellicotteville.
Okay.
And
what do you have out there, very briefly?
we have outpatient clinics, so access points for veterans where both primary care and mental health are delivered as 2 primary services, and they are all part of the Erie VA healthcare system. And so we have engaged with the veteran service officers, the not-for-profits, community groups, social services agencies, and all those areas to make sure that they know that of our existence, how to get in contact with us. And we've developed community engagement boards, not only here in Erie, but places like Bradford and like Warren, that they have veterans councils that I attend and am part of. And we discuss veterans issues, not just for healthcare either. You know, we have veterans benefits, the National Cemetery Association, and all the social services available so that we can do warm handoffs with each other.
Okay.
So if somebody comes to me and says, hey, John, interested in a job, and I say, well, maybe that's not exactly what I do as job placement. I do the healthcare piece of it, but I can call Career Links and say, I know the person who runs this, and we can get you in contact. So the key is there is no wrong door. We will continue to make warm handoffs to the veterans that we serve and make it a seamless process for them.
It seems like, to me anyway, just sitting here listening to you talk, the process is expanding from within.
Absolutely.
Okay, you're not just a regular VA hospital, that you're trying to make it as much accessible to all areas and resources that you possibly can, which is great. Because let me ask you this, so when they go to these outpatient clinics in these 5 areas, what you have, they can be referred to our hospital here in Erie?
Absolutely, they become part of VA healthcare.
Okay.
So any service that they need, whether it's medical, behavioral health, social services, maybe it's caregiver support, they are entitled then, once they're registered for VA healthcare, for all those services. And we've done a wonderful job not only reaching out to veterans who are eligible for VA healthcare, but even those from a behavioral health standpoint, to make sure any veteran in crisis, regardless of their eligibility for VA healthcare, has the means to contact our behavioral health providers to ensure that any veteran in crisis can reach out to us, and we will take care of that veteran and meet them where they are. Let's
talk about that. I know the last few years since I moved back to Erie, they've been building up the behavioral health care aspect of the Veterans Hospital and administrations all over the country, actually.
Absolutely.
And you know, Mr. Gennaro, I was in psych for 20 years, and we used to think that it was a myth, actually, that the PTSD was just for people who were in the military, but actually it's a medical condition, if anybody knows that. And you have that throughout the veteran population all throughout the country. So for them to go into the area of behavioral health in the way that they're going into it, how important is that to the veterans in this country?
It's very important. And you know, it takes courage of a warrior to ask for help. That's the hardest part sometimes, people, and veterans especially, because you know, asking for help in the military could be a sign of weakness when you're in the military.
That's excellent.
But you know, as an individual, as a person, every veteran who's listening to this now, any family member who's listening to this now, needs to know that asking for help is the right thing to do, and it takes a lot of courage to ask for help when you need it most. And we have highly qualified professionals, psychologists, providers, peer support specialists, fellow veterans who will engage with veterans on the path to recovery, and we'll meet them wherever they are and build that plan of care centered around the veteran's need. And we'll find out exactly what they need. Maybe there's substance abuse, maybe it's PTSD, maybe it's simply just supportive services to get reintegrated into finding a job. And we offer job services for veterans. And our goal is to reintegrate every veteran through the recovery model and place them back into the community as highly functioning members of our community.
Okay. So do y'all have inpatient, outpatient? What do y'all have up there as far as behavioral health?
We actually have outpatient services for behavioral health.
Okay.
And then we work with our community partners here within Erie for any kind of inpatient services. And then primarily VA Pittsburgh healthcare system in Pittsburgh has acute inpatient services.
Okay.
Now the exciting thing that's going to happen over the next year is I've recognized the need coming into Erie, having experienced at many other facilities, that there's a program called residential rehab programs.
Okay, so that's what, go ahead.
And that's actually something that we're developing currently, and we're going to have at the facility as yet another resource and program for veterans of Erie County and the areas that we serve. And basically what it'll be a 30 to 60 day type program where veterans will come in, we'll have 8 beds. They'll be able to stay overnight as a residential program and have comprehensive day treatment programs with our behavioral health team, case management, to make sure that they're getting the help in the areas they need. Ultimately, they're with us in a very structured program for the time period they're with us.
And what is that time period?
30 to 60 days typically.
Days? Okay.
And then we will align them with the social support services, job training skills, the HUD-VASH program, which is our mechanism we have where we place veterans into apartments into the community, integrate them back into the local community, and ultimately get to the point where they have a job, they're paying their rent, and they're simply coming to us like anybody else would for an outpatient care appointment. And that's ultimately the goal, is the reintegration back into the community.
Well, it goes without saying, Mr. Gennaro, I'll use that term a lot, it goes without saying, but they could use, how many beds you said y'all going to start off with?
We're going to start with 8.
They could use 80
We're going to film
beds.
quick. We're going to film quick.
Y'all can use 80 beds all throughout the whole country, because that's exactly what the need of the veterans are in this country today. A lot of them are dealing with comorbidities, you know, which is a dual diagnosis, and they need those services which y'all going to offer them, which is tremendous. And I'm glad that somebody had the vision to understand this, and going forward, it goes without saying, y'all going to fill those 8 beds the first day and y'all going to stay filled.
Absolutely,
You know?
and our ultimate plan is we're going to have those beds inside the main facility. It'd be wonderful one day, and we're going to look at plans to build a residential facility on campus.
Okay.
And that'll be a complement to all the services that we have at the Erie VA. So I mentioned we have the primary care services, behavioral health outpatient. We run a community living center, which is a nursing home. So we do rehab programs for physical rehab.
This is on campus on 38.
Campus,
Okay.
yep, and inpatient.
Okay.
And we take care of veterans in terms of long-term care, a nursing home, short-term care type of rehab, respite care, palliative hospice care, end-of-life care.
Okay.
And we have acute care medicine. So we have the ability to have veterans with a multitude and a range of diagnoses and needs to be taken care of here right at the Erie VA.
And that's excellent. And I just wish that more people would be able to get the word out to these guys. I'm sure y'all serving what's the number?
Over 22,000 veterans right here in our catchment area.
Okay.
Over 22,000.
Over what period?
In 1 year.
In 1 year,
In
okay.
1 year time frame.
See,
Absolutely.
and now y'all been recognized for something. Was that the service and the quality of the service that y'all been recognized at Erie's Hospital? Veterans?
Absolutely. That's one of the things I referred to at the beginning of the show, is the 5-star status in terms of our quality overall program. So a 5-star facility, both in medicine and our community living center.
Well, you know, from being other places and seeing other facilities as far as the veterans go, when you just drive by 38th Street and you look over, it's just something that stands out about that facility. And it has been, I was born and raised here, and it has been ever since I was a child, going over 38th Street, whether it was east or west, going past there, it just stands out. And it's a symbol of something that the community can be proud of.
Absolutely. When we're part of the whole economic development, of Erie in general, we're bringing jobs, to the area. We have over 800 individuals, most of them in the medical profession, obviously being a hospital, that are great, stable jobs, here in the community. We've added programs like the residential rehab program, so that's additional nurses, LPNs, physicians. We've added a program called Whole Health, so we have complementary alternative medicines. And so that's for treatment of chronic pain in veterans and making sure that rather than simply just a prescription for pain medicine to give a veteran, we're trying to holistically work with and find ways to deal with the chronic pain that veterans face. And so we have a host of individuals who are peer support counselors, osteopathic providers, chiropractors, individuals across the board being part of that program to deliver abundant resources and care to our veterans.
Well, you touched on something early on in the program when you talked about just the mentality and the makeup of a veteran. It is hard for them to reach out for the help that they need, but once they do that, they'd be much better off, just like any other person, whether they're a veteran or not. You have to be able to recognize and understand that you have a problem before you can begin to solve that problem.
Absolutely.
And I think that it is a little bit tougher because most people don't never experience some of the things that the veterans in this country do. And if it wasn't for those guys serving then and now, it'll be a different story.
Absolutely.
Especially with everything going on in the country and in the world. What's coming up for 2019 as far as the veterans? Are y'all planning any celebrations or any type of events or anything going on?
Yeah, absolutely. Part of the whole modernization, what you see happening on the campus, we're going to have a number of additional projects come to light. We just finished with a new improvement, a new boiler plant. So that's basically the heart of the facility that produces the steam, the heat for the facility. So that's kind of a utilities type project. We're going to make it safer to get in and out of the facility. And we're working with PennDOT, and we're going to have a new traffic light installed on 38th Street. So we have a new entrance to the facility. Out on the front lawn, if you will, we have a new 20-bed community living center that's replacing the 4th floor of the hospital, and that's going to be for all long-term patients. So we're recognizing the change in environment in terms of healing environment for veterans, and so we're taking them out of a more institutional feel inside the hospital, and this is going to be all private rooms, private baths, wonderful areas for veterans to engage with their loved ones, their families, to cook a meal, and have rehabilitation type areas right within that new environment. And that's going to be one of 2 phases that we're planning to do for a total of about 53 beds when it's all said and done.
And when is that supposed to be all said and done?
The first phase will be done over the summertime, and we're going to start design hopefully come the fall, the winter time next year for the second phase.
That's excellent. That's excellent. Which once again just ties right into what you were talking about, the not only the help and the care that you're giving the veterans in the community, but also the economic boost that you're giving to the community, because somebody got to build this stuff.
Absolutely, yeah. We've awarded just in the last couple of years alone, since I've been here, nearly $35 million in projects. And that's going to bring, and has brought, over 300 jobs to the area to construct these projects and buildings. In addition to that community living center, we're going to have a new dental clinic on the 3rd floor with new operatories for dental. We just opened a wonderful new canteen space. That's the area that veterans and family members, staff members go to have lunch, breakfast, and a gathering space. So it's a nice environment, a cafe type environment for veterans. As I mentioned, we're going to have the residential rehab program on the 6th floor, which is under construction and being finalized. And then we're going to ultimately go forward with additional plans to expand our primary care area. So a lot of great things happening at the Erie VA.
It sounds like it. It sounds like it. In order for the community to get behind something and feel as though it is pretty special, like the Veteran Hospital here in Erie, you have to have the type of leadership at the top that people expect to make this happen. What brought you to Erie?
Personally and professionally. Back in 2006, I was the chief operating officer here, about over 10 years ago.
Oh, really?
And so
yeah, I've seen that in there.
That was one of my first experiences with the Erie. I was born and raised in Northeast Ohio, so coming from a blue-collar family, hard-working family. The resemblances of where I grew up in Parma outside Cleveland and Erie were very similar in terms of the community. And so I had a great experience with the hardworking staff at the Erie VA. Obviously went to multiple other sites, other VAs over the course of the 10-year period. And when the opportunity to come back to Erie, not only for the workforce that we have that's dedicated and serving veterans, then I had a great experience when I was here previously, but then also being close to family in Northeast Ohio, it was a perfect match for us to come back and kind of reintegrate and reestablish roots. So it's been a wonderful transition over the last nearly 3 years now.
Good, good. Well, people make a lot about the winners and all this and all that, but they also don't make enough about the summers.
Absolutely.
And when people decide to make this area their home, they're willing to accept the good with the bad because it does offer a lot. They got a lot of stuff going on here in Erie going forward in 2019 into the coming years. Where do you see the VA fitting in that particular spot? Has the mayor reached out, or anybody from the administration, governor, county executive, has anybody reached out with their support?
Yeah, we have great working relationships with Kathy Dahlkemper and Mayor Schember.
Okay.
They're very supportive of what we do at the facility and understand that we're a key part of the community in terms of going forward. And the modernization efforts that we have, like I said, going forward are fully supported by the community and the government officials because we're all in it together. We want to make this a better community for the veterans we serve, the employees that come into the county and to Erie that they are employed there, and ultimately provide and have Erie as a beacon, if you will, a resource for all veterans and their caregivers to make sure that they're getting the help that they need, not only for the veteran, but for those caregivers who are taking care of veterans who have fought the fight.
Yeah, well, Mr. Gennaro, the people in the city really appreciate the Veterans Hospital and the administration overall for what they're doing for the veterans here. Is there any other organizations that you established working relationships here?
Yeah, absolutely. One of the key components of working with the county even is the Veterans Justice Outreach Program. So that's a partnership between us and the court system so that veterans with non-criminal, non-felony type offenses, like misdemeanors, they're able to actually engage with our treatment programs, and that could be in lieu of possibly a sentencing. So the most important thing is the veterans are getting help that they need to deal with the underlying root cause of the issue versus simply paying a fine, spending time in jail. And we have a full-time Veterans Justice Outreach Coordinator who works with the court system to engage. Yeah, and so that's the way you address the issues. That's how you reduce the recidivism. The folks going back into the system and not getting the help that they need. So of course we work directly with the County of Veterans Affairs, Thad Plazinski. We work with the Veterans Justice Outreach and the courts, and we've established a local community engagement board. So we work very closely with Sandra over at the Vet Center, so very close-knit with the Combat Vet Group. We have folks from Career Links and George Tanner from Career Links there. We have individuals from the state police, PA State Police involved on the board, embracing our veterans. And so a number of different veteran groups, Team Red, White, and Blue. And so that's what we've done is establish a network for us to talk about veterans, things that veterans need, and be able to coordinate that care across the community. In fact, I asked the viewers to look out for Community Engagement Board. It's the Erie Veterans Advisory Council, and to look out for activities that the council puts on so that they can engage with members of the board so they can get addressed any kind of questions they may have for veterans, about veterans, or the caregivers, get those questions addressed.
Good, good, good. It sounds like you're moving in the right direction. And once again, like I said, the hospital in itself is a very valuable asset to this community. Going forward, and in hindsight, when you look back, when you were here before, do you have the same people pretty much in place that you have now up at the hospital, or was there much of a change since you?
There's been a lot of change, over the last decade or so, and I think we've taken a lot of the very high focus on results and outcomes, and also added the customer service piece of that and the engagement of both the veteran and the community, for that matter, into kind of our complete package. And that's how I view myself as a leader at the Erie VA. It's not simply operational. If I'm doing the operations, I'm not doing my job. And I've told this to our supervisors and our staff at the facility. I said, we have 800 folks and we have 75 supervisors to engage and take care of those employees. It's my job too. But I need to be taking care of the 22,000 veterans and the 100,000 people in the community. So I need their support to take care of the 800 so I can take care of the
That's
120,000, right? So
true.
You got to put it in perspective, right? And so that I view my job as doing great events like this, partnering with the local media folks, yourself, Vernon, on this kind of show where we can share the good work that's happening and be a figure, in the community so that we can, put the name of the VA and all the good work that we do at the Erie VA, out front and be very transparent, be very visible in all we do.
Okay, well, one way to do that is to come on these shows. You know, I mean, I think my viewership is growing, and it's always a pleasure to have people on the show that are making a difference in the community, okay? And you're making a difference in the community, and you're doing it in a very positive way. And that's the only thing that we can look at it and hope for others to follow the lead of the VA. And one thing that I want to touch on, because you're right, they don't get a lot of the hoopla and the fanfare, and more importantly, the recognition that the VA deserves, not only here in Erie, but throughout the country, until something goes wrong, and then everybody want to jump on the bandwagon and start throwing arrows at what's going on instead of looking at what's going on right. And the programs and everything, what you're doing up there, implementing, is nothing but good for the community. Wrapping it up, 5 years from now, where would you like to see the Veterans Administration Hospital here in Erie?
I'd like to continue to expand the veteran population. I think that's going to be the key. And if I can stress one point, is for any veteran out there, any family member of any veteran, I want to see the number of veterans receiving care at a hospital increase. Not because people may be need of the care, but that we're growing the number of folks that we're treating from the standpoint of enrollment. Because veterans, for many reasons, they think that maybe they're not injured in combat, so they aren't eligible for services, or maybe they make too much money and they can't be eligible for services, or they think maybe another veteran needs it more than me. The key is for every veteran in our county and catchment area to enroll for VA services, because you're going to be helping other veterans who may need it more than you. So that's a key takeaway point.
Well, and y'all are open, what, 24 hours a day, 7 days a week for any type of service, or?
Our inpatient facilities are. We have an urgent care that operates 365 days a year from 8 a.m. to 8 p.m.
Okay.
And then we have our outpatient clinics that are more business hours.
Okay.
Yes.
And then everything is centered and focused on making the lives of the veterans in this city and country better.
Absolutely. That's our mission.
I want to thank you, sir, for coming on the show, Mr. Gennaro. And once things get up and popping up there, continue to be up and popping up there, I want you to come back on here and let us know exactly where you're at in the process of making your vision and the vision for the Veterans Administration complete. Okay, the pleasure's been on mine. And once again, I can't reiterate enough, this is somebody who is doing positive work in the community for a population of the community that really deserves it, okay? Nobody's more prouder than the veterans than I am. My father and a lot of my uncles were in all the wars that we've had so far, and friends. So once again, thank you, sir. And to everybody viewing, the pleasure is all mine. We'll see you again.
Thank you.